Good morning, everyone, and welcome. We're grateful that you're joining us for this plenary for the Royal Society of Canada report on COVID-19 and immigration, Vulnerabilities Revealed and Recommendations for the Future. My name is Natalia Brown. I'm an associate professor in the Department of Political Science, Philosophy and Economics, and the School of Business at InPerson University. In April of this year, the Royal Society of Canada established a task force to provide evidence-based perspectives on the major societal challenges emerging from the COVID-19 pandemic. The task force established a series of working groups to develop policy briefings. Pathways to Prosperity was asked to form a working group to develop a policy brief on COVID-19 and immigration. The brief provides context prior to COVID-19, examines the vulnerabilities exposed and lessons learned from the pandemic, and makes recommendations for the future so that we can fully actualize the benefits of immigration. Now, our 9-member working group is led by Pathways to Prosperity co-chairs, Victoria Esses, professor in the Department of Psychology and director of the Network for Economic and Social Trends at Western University, and Jean McRae, Chief Executive Officer of the Intercultural Association of Greater Victoria. Other members of our working group include Naomi Alboim, Distinguished Fellow at the School of Policy Studies at Queen's University and Senior Policy Fellow at the Canada Excellence Research Chair in Migration and Integration at Ryerson University. Chris Friesen, Director, Settlement Services at the Immigrant Services Society of BC, Chair of the Canadian Immigrant Settlement Sector Alliance, and co-chair of the National Settlement and Integration Council. Leah Hamilton, professor in the Department of Management and Human Resources at the Bissett School of Business at Mont Royal University. Aurélie Lacassane, associate professor in the Department of Political Science at Laurentian University. Audrey Macklin, professor of law and director of the Center for Criminology and Sociolegal Studies at the University of Toronto, and Margaret Walton Roberts, professor in the Department of Geography and Environmental Studies at Wilfrid Laurier University. So we're pleased to have Naomi, Margaret, Leah, and Chris presenting today. Their presentations won't cover the full range of vulnerabilities recommendations. Our report will be more comprehensive. Next slide, please. So their presentations will focus on the impact of COVID-19 on Canadian immigration policy and programs, on specific vulnerable groups and essential workers, on public attitudes towards immigrants, and on newcomers and the settlement sector. So before we begin, I've been asked to let you know that as the audience, you can submit your questions early on Slido. So during the presentation, you can do that, and we'll take them up at the end of the presentation. The Slido code is hashtag P2P2020. So now I'll hand it over to Naomi to start.
Good afternoon, everybody, and thanks for the introduction, Natalia. It's my pleasure to kick off this panel with all the people with whom I've been working, and it's been a pleasure to work with everybody else on this particular project. I'm going to be addressing some of the highlights of the impact of COVID-19 on migrants, immigrants, immigration policy, and programs, although I must say, following the minister is a hard act to follow. Next, please. So let's look first at admissions. As we know and as we've heard, it's evident that border closures resulted in a significant decrease in admissions over the past year for all classes of permanent entries, economic, family, and refugee, but also for all temporary entrants, temporary foreign workers, people in the International Mobility Program, international students, and asylum seekers. There have been exemptions put into place for essential temporary workers, for example, in agriculture and in the healthcare sectors, for international students, and as you heard, for a few urgent resettlement cases and family unification cases. And while there was an early exemption for asylum seekers, that's no longer in play. As you also heard, really the source now for permanent residents to be landed is much constrained because of the border closures. So basically, it's people who did have their visas and utilized their visas before the lockdown, and people already in Canada with Canadian experience as high-skilled temporary foreign workers or international students. Those are the people that are now being processed primarily for permanent residency. Next, please. So what are the implications of these reduced numbers over this period? They are both short and long-term impacts, and these impacts will continue if the border closures continue for much longer. So for example, there are labor market implications. We've relied on immigrants and temporary entrants to fill labor and skill shortages. Our economic growth is very dependent on new immigrants coming in and the stimulus that they provide. Our demographics or our population growth is really dependent on immigration. Family unification will be delayed. We are not going to be able to meet our humanitarian objectives at a time when refugee situations are getting worse around the world. Our colleges and universities, who are already facing budgetary crunches, now are also missing out on the international students' fees, which is just exacerbating their budgetary situation. Our regionalization goals will be slowed down. Our Francophone immigration goals will be slowed down. And there have been particular sectors that are dependent on immigration that have been badly hit. Next, please. In addition, it's really clear that recent migrants and immigrants are more at risk than other members of our population because they have lower incomes than Canadian-born or longer-term immigrants. They tend to live in denser neighborhoods. They live in more crowded housing, often with intergenerational large families. They're more dependent on public transit. They have less access to green space, which means that they have less opportunity to spend time safely outdoors with safe distancing. And they generally are in riskier jobs with riskier working conditions that make them more prone to infection. Next, please. In terms of employment, recent immigrants, and by that I mean those who've been in the country for less than 5 years, lost their jobs more than Canadian-born or longer-term immigrants during COVID-19. For many reasons. They are more concentrated in low-wage jobs in the affected sectors. There's little opportunity for them to work at home, given the content of their jobs. They have shorter job tenure than these other population groups, and therefore they might have been the last hired and maybe the first let go. And they are certainly overrepresented in precarious work. In addition, recent immigrants have transitioned back to employment less than Canadian-born in the early recovery, and the second wave is now making this worse. These work interruptions will likely increase family earnings inequality, at least during the pandemic and economic recovery. All this data I am getting from StatsCan, who has done a really terrific job in doing all kinds of analysis based on the numbers that they have through the Labor Force Survey and other surveys, and it's all available on their website. Next, please. So while COVID has shone a light, it's really shining a light on what we've already known and already do know. Number one, that there really is a differential impact on migrants and immigrants, racialized groups, women, particular regions, and particular sectors, with racialized migrant and immigrant women in low-skilled service jobs being the hardest hit. Number two, we have found that it's clear that essential work does not always require high human capital. Number three, that Canada is dependent on temporary foreign workers and immigrants to do essential work. Number four, that essential workers are often undervalued, underemployed, face increased risks and vulnerabilities, yet have inadequate protections. And five, that skilled immigrants in regulated professions face barriers to practice, even to do essential work. Think of international educated health professionals, for example, who could really contribute. Now, those points in terms of particular population groups will be further talked about by the next speaker, and Margaret is going to be giving case studies about particular population groups. Next, please. There are other COVID-related learnings that I think could have real implications for future immigration policy going forward. We have learned that many high human capital jobs can be done remotely from home, and home could just as easily be in an apartment building in New Delhi as it is in a suburban house outside of Toronto. Studies can be done remotely from abroad, as we have seen now with many international students beginning their course of studies in their home countries before they can freely come to Canada when the borders are open again. COVID has made it clear that we need workers on the ground here in Canada across the full labor market continuum and not just at the high end. And we need a steady supply of workers who will bring security to our food, our healthcare system, and other sectors. Next, please. As you know, and as the minister restated today, the government did announce increased levels for 2021 and 2024 in all immigration categories, which is really good news. But there hasn't really been any specificity in terms of announcements regarding policy or program or resource changes to ensure that the new levels are met. Next, please. So this leads me to some policy recommendations, and there are three major groupings. The first is, how do we ensure that increased targets for immigration are actually met? So the government must ensure adequate resources, and I would say simplified procedures, both abroad and in Canada, to ensure expeditious processing of the increased applications that we'll be seeing over the next few years in all immigration classes and temporary entrant categories, not only to satisfy the targets, but to satisfy our long and short-term objectives, to respond to pent-up demand in all categories, economic for sure, family absolutely, and all refugee categories, including government-assisted refugees, privately sponsored refugees, and refugee claimants. Next, we really should be reviewing and expanding the criteria for immigration admission under all programs and pilots to respond to our longer-term demographic and regional needs, but to also respond to broader labor market needs beyond those simply requiring high human capital. We also need to select more applicants as permanent residents with their families from the get-go, to not necessarily rely on two-step immigration, and develop more pathways to permanent residency for temporary workers at all points of the labor market continuum, especially in essential occupations. Next, please. The second tranche of recommendations deals with avoiding and addressing potential scarring, which we really need to do. We have to develop training and adjustment programs to prevent and counter that scarring effect for immigrants who either have lost their jobs as a result of the pandemic or enter Canada during an economic downturn. We have learned sadly after the fact about the fact that such scarring can take years to overcome unless it's dealt with effectively right from the very outset. And we have to develop, I think, both economic and social initiatives, educational and social initiatives for immigrant children who have been disadvantaged by disruptions in their education because of school closures or difficulties in online learning, in order to help them catch up and integrate effectively. And lastly, next slide, please. The third tranche is to provide protections for temporary entrants who will continue to enter the country. We recommend that we consider issuing provisional temporary work permits to workers abroad who can work remotely until they can travel to Canada, that we expand workplace and housing protections for temporary foreign workers and enforce proactively to ensure employer compliance. Next, we believe that we should be introducing sectoral or regional or even open permits to temporary foreign workers, not just employer-specific ones, and this will go a long way to reduce their vulnerabilities. And lastly, to provide access to federally funded information and settlement services for temporary workers, refugee claimants, international students, and their families. And Chris will be addressing that point more in his section. Those latter groups are the groups that constitute a pool of potential permanent residents who should be supported from the outset to facilitate their effective integration into Canada. And now it's my pleasure to hand it off to Margaret Walton-Roberts, who will pick up on particular population groups and case studies. Thank you.
Thank you, Naomi, and thank you. I'd like to reiterate Naomi's comment about what a great group this has been to work with on this report for the Royal Society of Canada. I'll be talking about vulnerable groups and essential workers, highlighting some case studies: agricultural workers, healthcare workers, and international students. Next slide. So we, as Naomi identified, we recognize how the health and the economic crisis associated with a global pandemic has differentially impacted racialized and marginalized communities. And so the pandemic has really revealed truths about Canadian immigration and society that were there. Certainly one of those has been recognizing how vital temporary agricultural workers are for Canadian food security, and also recognizing how racialized immigrant women are overrepresented in key frontline healthcare roles. And we also became acutely aware of how international students are highly vulnerable to pandemic-related economic and mobility disruptions. And this was a significant policy issue for Canada during this time of a global pandemic. Next slide, please. To begin, just thinking about temporary agricultural workers. In 2019, temporary foreign workers, about 20% of the agricultural sector employment is satisfied through the role of temporary foreign workers, and that represents about 60% of all temporary foreign workers in Canada. So agricultural work is a significant dimension of the temporary foreign worker community in Canada. And Canada's food security is potentially threatened in the disruption that was associated with the pandemic. There were delays in work permit processing, there were recruitment barriers in getting workers to the farms where they work. And as we all know, in the agricultural industry, harvesting is highly seasonal, timing is essential, and this was a real challenge in the early stage of the pandemic. So the pandemic really did expose Canada's dependence on cheap foreign labour and long-standing problems of poor working conditions that have been highlighted for a long period of time by many researchers here in Canada. The federal government did respond, and the minister talked about this in his earlier presentation. The minister actually mentioned $100 million investment, but certainly we know that health and safety investment to protect temporary foreign workers is at least in the realm of $58.6 million. This was announced for increased inspections, improving living quarters and emergency housing, providing PPE and sanitary stations. And this is certainly important and highly welcomed, but there are still significant issues in terms of enforcement and in terms of understanding the regulatory responsibility in the area of temporary foreign workers and their protection. Next slide, please. In terms of frontline healthcare workers, it became acutely obvious during the pandemic how dependent our long-term care sector is on immigrant workers. So 50% of long-term caregivers in some provinces are immigrants, and in some provinces it's higher than this. And what we have found is that this population, a racialized, highly gendered community of workers, is actually highly skilled as well. So 45% of more recent immigrants working in long-term care have at least a bachelor's degree, and a significant number of those have bachelor's degree in health-related occupations. We also understand the vulnerability that these communities face in terms of infection and mortality due to COVID-19. So studies that have been done in Ontario identified that of all women infected with COVID-19, over a third of these were healthcare workers, and a half of those were immigrants and refugees. We also understand increasingly the significance of how foreign educated immigrants are seriously overrepresented in this sector, especially those with health-related education, and those skills are being underutilized. And so as we review how the country has responded to the pandemic, we need to certainly recognize this resource that we have present within the country. Next slide, please. Another vulnerable population is international students. In 2019, there were more than 642,000 international students in Canada. This represents a 185% increase since 2010. Canada is now third globally in terms of its attraction of international students. So this has been an explicit area of concentration and growth that Canada has engaged in. In June of 2020, after the beginning of the pandemic, West did a survey which identified that 26% of international students had reported losing their primary source of income, and 34% reported finding it difficult to afford rent or utilities. And so we certainly are aware of the significant disruption that was caused to international students and their need to find supports. The Immigration, Refugees, Citizenship Canada was certainly responsive and attempted to be flexible in its permit renewal for those students in Canada, but there were immense disruptions from border closures that incoming international students faced, and there was certainly a significant amount of chaos and problems associated with the experiences of those in country and those out of country. The other thing that has become apparent during the pandemic and the disruptions experienced by international students is the vulnerability of the post-secondary education sector. So we have seen Stats Canada data that's projected losses of anywhere between $377 million to $3.4 billion during the 2021 academic year. And this is something that we have to monitor, and it's really a wake-up call in many ways for thinking about, as Naomi said, how this post-secondary education sector is financed. Next slide, please. The report makes many recommendations, and here we've just drawn out a few selected recommendations to highlight. One of them, the first one, is of course to improve workplace protections and expand viable pathways for permanent residents and temporary foreign workers. And so Naomi reflected some of those issues in her slide. This is something that the report certainly focuses on. The second recommendation is to improve bridging and career pathways for immigrants in healthcare and to enhance transparency in regulatory processes. And so this would include, for example, considering how to develop a career laddering approach that allows work-based place pathways for underemployed immigrant professionals towards both licensed and certified roles and non-licensed roles. And this has become very apparent in, for example, in Ontario, the work of personal support workers and understanding exactly what kind of qualifications are needed, and then understanding where somebody working in that sector might proceed to. And so that career laddering idea is something we should be paying more attention to. The second recommendation under this is to develop bridge training programs with on-site work experience and mentorship components leading to licensure in regulated occupations. And third, to develop transitional limited licenses with pathway to full licensure. So we should have more flexibility and develop new innovative approaches to maximizing our use and the abilities of skilled workers in this sector. And we should make postgraduate work permits renewable in the terms of international students so that they can complete requirements for permanent residency during this pandemic job market, and remove time limits and remove industry restrictions on work. Thank you. And I'll pass on to Leah Hamilton, who will talk about the impact of COVID-19 on public attitudes towards immigrants.
Thank you, Margaret. Thank you to all of the wonderful members of the working group and to everyone here who's joining us today from across Canada. I'll be talking about the impact of COVID-19 on public attitudes toward immigrants. As many of you know, Canadians are seen as having some of the most positive attitudes toward immigrants and immigration in the world. And this is supported by the results of cross-national surveys of immigration attitudes. So for instance, in 2019, Canada actually ranked as the most accepting country for immigrants on Gallup's Migrant Acceptance Index. And similarly, in 2018, there was a Pew Research Center survey of attitudes in 18 immigrant receiving countries. And this survey found that Canada was at the top of the list in terms of seeing immigrants as making the country stronger because of their work and talent, rather than as a burden on the country because they take jobs and social benefits. So when we think about these effects and where they come from, they seem to stem from the fact that many Canadians believe that the economic impact of immigration is positive, and that multiculturalism and diversity are defining aspects of what makes Canada unique. However, it should be noted that these attitudes are not uniformly positive. So we do see differences that exist as a function of the personal characteristics of the respondents who are surveyed, and also of the characteristics of the immigrant groups in question. So for instance, Canadians who are less educated, those that live outside of urban areas, and those on the ideological right tend to be less accepting of immigrants. It's also the case that although attitudes toward economic immigrants tend to be positive, attitudes toward refugees and refugee claimants tend to sort of vary considerably over time, depending on the context. So for instance, if you think about the Trudeau government and sort of the peak of the 2015-2016 welcome for Syrian refugees, we know public attitudes toward refugees were quite favorable at that time. But then there was some evidence that there was a rise in negative attitudes in subsequent years, possibly because of the highly publicized asylum seekers that were entering Canada irregularly from the United States. And finally, we want to acknowledge that there has been a long history of exclusion and stereotyping of Asian immigrants. And this explains why many preconceived and negative ideas about Asians are deeply entrenched in the Canadian population. And so these prejudices remain internalized in many Canadians and do have the potential to resurface in times of crisis. Okay, so what has happened to these relatively favorable attitudes that I told you about? Well, to date, the public opinion surveys of Canadians' attitudes toward immigrants and immigration have actually revealed quite conflicting findings. So I'm going to start by telling you about the evidence suggesting attitudes may have become more favorable. So in September of 2020, Environics actually conducted phone interviews, and those results actually suggested that Canadians have become even more supportive of immigrants and refugees over the past year. And those results found that the majority of Canadians are comfortable with current immigration levels, and they see immigration as making Canada better, and they view immigrants as good for the Canadian economy. And these results were triangulated by Jack Jedwab, who found that most Canadians agree that immigrants will help Canada's long-term economic recovery from COVID. So that's sort of the good news story. But at the same time, there's other research that indicates that the pandemic may actually have led some Canadians to not be as welcoming to immigrants as they have been in the past. So for instance, in August 2020, Bruce Newbold conducted a survey, and about 20% of respondents said that their attitudes towards immigration have hardened since the pandemic began. Even though the majority did say their attitudes hadn't changed, there was that 20% that said their attitudes had hardened. And then when people were asked about post-pandemic immigration levels, the majority of respondents said that the number of new immigrants to Canada should be reduced. And only about 1 in 5 respondents said that immigration should be a key component of Canada's economic recovery strategy. So it is sort of difficult to interpret these conflicting findings, but here's what we know for certain. COVID-19 may create conditions that will lead certain people to hold more negative attitudes toward immigrants and immigration. So for instance, evidence suggests that anti-immigrant attitudes can increase when people feel a heightened sense of threat to their personal health, like many people do now during COVID, whether or not that health threat is actually directly linked to immigrants. In addition, the pandemic has increased most Canadians' feelings of economic and cultural threats that may lead to anti-immigrant attitudes. So for instance, these threats may be rooted in perceptions of economic challenges arising from the pandemic and beliefs that immigrants compete with Canadian-born citizens for access to employment opportunities, social services, and the like. Moreover, COVID-19 may heighten perceptions of cultural threats, such as beliefs that different cultural practices, such as attending in-person religious services, may be sources for COVID-19 transmission. COVID-19 also has the potential to increase authoritarianism, both through the rise of authoritarian leaders and by increasing citizens' own authoritarian tendencies. So both of these forms of authoritarianism may reduce public support for immigration. So there's some interesting research that was conducted in the UK and the Republic of Ireland right during the first week of lockdown. And they found that people who were high on authoritarianism and felt more threatened by COVID-19 were especially likely to hold negative attitudes toward immigrants. In contrast, though, I do want to mention that some theorists argue that COVID-19 will direct people's attention away from immigration because many people will be thinking about rebuilding the economy, they'll be concerned about education, they'll be concerned about the healthcare system, and as a result, immigration debates, so to speak, may be out of the public eye and attitudes may remain favorable. So when we turn to examining immigrants' experiences of racism during the pandemic, or what has been called corona racism, a pretty clear picture emerges. So data collected from respondents across Canada in June of 2020 revealed that immigrants were significantly more likely than the Canadian-born population to indicate that they feared COVID-19 related stigmatization because of their racial identity. And recent StatsCan data shows that visible minorities, particularly Black and Asian respondents, perceive more race-based harassment or attacks, and they feel that these incidents have gone up since COVID-19. After COVID-19 appeared in Canada, the Angus Reid Institute surveyed Canadians of Chinese ethnicity to learn more about their own experiences with racism and discrimination. And about 1/3 of those respondents indicated that they've been made to feel like they threaten the health and safety of others. And about 2/3 of respondents felt that the way that Asians are represented in the news, so for instance, Trump referring to COVID-19 as the China virus, that these representations lead to negative views of Chinese people. And an alarming 30% of those respondents reported having been personally threatened or intimidated. So how do we ensure that moving forward, Canada is a welcoming country for immigrants and refugees? So the working group recommends a two-pronged approach. So first, we must actively work toward developing a robust data collection and dissemination plan. And second, we should proactively engage in efforts to improve public attitudes and reduce the racism that immigrants experience. So for the first recommendation, we feel it's very important to fund a working group that's tasked with regular monitoring Canadians' attitudes toward immigrants and refugees during and after the pandemic using a longitudinal multi-method approach. So specifically, we think it's important to examine how public attitudes are sort of influenced by the ups and downs of the pandemic. So those sort of open phases versus more restrictive lockdown phases, as well as during the post-pandemic recovery period. And those surveys should also assess those factors I mentioned that may influence public attitudes. So things like feelings of threat, perceptions that immigrants compete with the Canadian-born population for jobs and social services, and authoritarianism tendencies. And these data should definitely be collected in a way that will facilitate direct comparisons over time. At the same time, it will be equally important to examine immigrants' perceptions of public attitudes, belongingness, and their experiences of racism and discrimination during and after the pandemic. So careful attention should be paid to racism reported by individuals with Chinese ethnicity. So monitoring both public attitudes and immigrants' perceptions and experiences will provide a wealth of information about when and where public attitude interventions may be needed. The other thing I want to mention is when it comes to the importance of robust and transparent data, public health officials are encouraged to collect, monitor, interpret, and share robust data on COVID-19 testing, infection, and hospitalization rates. And to systematically examine the role of ethnicity, gender, immigration status, and other vulnerabilities that we're talking about here today as part of broader health equity plans. So as many of you know, early analyses, for instance, in Ontario, suggest that immigrants and refugees have disproportionately high COVID-19 infection rates. And although these infection rate disparities are largely a function of structural racism, they also have the potential to create anti-immigrant attitudes by creating disease concerns. So this can be avoided if public health officials, politicians, and the popular media provide accurate information about why COVID-19 rates are higher for racialized groups. For instance, by highlighting structural inequities that put immigrant groups at risk, such as a greater likelihood of being employed in precarious occupations where physical distancing isn't possible, such as warehouses and meat processing facilities. And in addition, it will be important for the government and other stakeholders to remain vigilant about the circulation of fake news on social media, particularly news that may represent immigrants and refugees as vectors of disease. So there are several additional ways that stakeholders can proactively engage in efforts to improve public attitudes toward immigrants. Research suggests that the beliefs espoused by the government in power do influence public attitudes toward immigrants. So it will be important for politicians to frame immigration in terms of the long-term benefits to Canada. So to some extent, this was done when the government recently unveiled the revised immigration levels plan. And this morning, where Minister Mendocino said that immigrants drive our nation's economic growth. So political discourse that emphasizes the importance of immigrants to Canada's immediate and long-term response will be important for keeping negative attitudes at bay. So for instance, politicians can choose to highlight the essential role that immigrants have played in the response to COVID-19 through their work as personal support workers in long-term care facilities. To date, politicians have focused mostly on highlighting the role of economic immigrants in Canada's economic recovery strategy. So it will be interesting to see whether our humanitarian commitments are highlighted a bit more at a later date and how Canadians respond to that. So finally, we would encourage IRCC to continue to fund indirect settlement programs that foster positive relations between immigrants and members of the host community. So we know that the pandemic has made it difficult to engage in face-to-face contact. So given that, it will be important for the settlement sector to build innovative programs that create opportunities for positive virtual contact between immigrants and host community members. So thanks. I'm now going to turn things over to Chris Friesen, who will speak about insights from the settlement sector.
Thank you, Leah. Good morning, everybody from the West Coast. I'd also like to acknowledge and echo the privilege of my working group members here and the opportunity to provide you with insights into the vulnerabilities of newcomers in the settlement sector, as well as a few recommendations as part of the Royal Society of Canada paper. Before I jump in, I want to acknowledge the past 8 months have been extremely stressful and challenging on multiple fronts. But also, though, this time has exemplified the tremendous innovation and resilience of the settlement sector and the extraordinary collaboration between IRCC and the settlement sector. And this has been illustrated through a number of different examples, including the collaborative RAP COVID-19 task group, greater communication and responsiveness by IRCC, both nationally and regionally, to service providers' needs, enhanced communication and collaboration, and even things like response to personal protection equipment and IRCC's role in helping to provide that to RAP service providers across the country. You know, once again, COVID-19 has really exemplified our role as nation builders and our ability to support newcomers where they are at in their settlement process. So vulnerabilities, delayed settlement and integration processes. You know, we've seen quite clearly how familiarity or the lack of familiarity, access to technology has impacted newcomers' settlement and integration process. Many service providers across Canada have undertaken various client and student surveys to better understand the unique challenges faced by their clients during COVID and how best to respond to them. Inequitable access to information. You know, the complexity of the federal, provincial, territorial COVID emergency income supports has been daunting for non-English and French-speaking newcomers. Some newcomers, such as resettled refugees who landed in 2019, faced additional challenges, you know, trying to find the support they need to file their 2019 income tax during the lockdown in order to avail of some of the federal and provincial benefits that they were eligible for. We've also seen the delays in government processing, you know, permanent resident cards that has had a downstream implication with accessing provincial health cards and IDs. Poverty. We've seen firsthand the impact that poverty has had on some immigrant and refugee families, especially those that are recent to Canada. We have observed a greater observation and need for families to access food banks and other food security programs in and outside suspended school lunch programs to augment basic needs. As you've heard now by my colleagues on the panel, racism and racist attacks, particularly in against anti-Asian and Black population, has really increased the sense of vulnerabilities. And this has been matched by service providers not always having the skills and capacity to support newcomers who have experienced such hatred. Next, please. Family violence and domestic abuse. Untreated pre-migration trauma, families concerned about family members abroad in COVID hotspots, the presence of families living in close quarters, trying to observe health recommendations, having children home from childcare or schools, has all elevated stress and domestic violence. Deteriorating mental health. You know, we've seen this in particular among older adults and seniors, refugees without family or friend links, and those newcomers from smaller ethnocultural communities. And we've also seen a disproportionate challenge for single parents with multiple children at home. Next, please. So, turning our attention now to the settlement sector and service providers, the challenges and vulnerabilities. We all suspended services temporarily during the lockdown, and then had to rapidly transform and pivot to hybrid delivery models. And this has been different across the country, of course, as a result of the uneven COVID cases. Inadequate and outdated technology tools. Boy, was that ever drawn to the surface. You know, how many settlement staff had ever heard and knew how to use Zoom or MS Team or one of the other conference platforms before this time? Did staff have the computers at home? Did they have cell phones to be able to continue to support newcomers from working from home? These were daunting tasks in the early days. We have seen, you know, program delivery challenges, particular to vulnerable at-risk newcomer families. And this has posed significant challenges, augmented by the fact that certain newcomers, highlighted by the digital divide, did not have access to technology and little or no digital literacy skills. So those newcomers facing the greatest risk were our greatest challenge of how to support them during this time when we weren't initially able to open for in-person services. And who could forget the chaos in those early days when we were all scrambling to locate and secure personal protection equipment for staff and some clients. And the fact that in certain regions of the country, there was easier access than other regions of the country. This is an area where, you know, we really want to commend the collaboration between the sector and IRCC in their ability to source out for our behalf personal protection equipment that was delivered to all RAP service providers across Canada in order to continue to provide essential critical RAP services. Next, please. Staff training and working from home. Wow. You know, working through a crisis, you know, revised and adjusted activities and targets. You know, in some cases, service uptake increased because of online workshops that could suddenly reach more newcomers than those that could have participated in person. But it has been a complex process. Security and privacy, utmost our attention, again, particularly from working from home. You know, the sector discussions continue around, for example, the ease of using WhatsApp as an example versus the ability to protect client confidentiality and privacy. This is further exacerbated when staff working from home are, in some cases, using their own cell phones to deliver client service. Managing staff productivity, morale, and work-life balance and boundaries. We must acknowledge the heightened stress and anxiety among staff. You know, how do you avoid the tendency to work 24/7 because of the ease of working from home, you know, whether that's in the evenings or weekends? Not surprisingly, of course, too, because COVID had impact program delivery and program offerings in different ways. It also highlighted uneven staff workload. Staff were working more than they ever had, and other staff less so. And that meant reassigning new roles for those staff that were even more impacted during this time in their inability to continue to deliver the services in which they were funded for. The lack of skills and capacity to respond to racism, this has come up now a number of times that you've heard through this plenary discussion. And for the sector, again, really pointed out a gap in our ability to support our clients through sometimes very difficult vulnerabilities. Next. So the resumption of some in-person services, you know, and many regions of Canada, the sector and COVID has meant not being able to fully reopen offices, you know, forcing the continuation of staff working from both home and offices. So this has reduced office-based service offerings, in some cases 50 or more %, you know, due to the fact that we've had to maintain you know, a maximum number of client and staff within designated in-person spaces, following different public health guidelines in different regions of Canada. Lower PR landings in 2020, we know, we've heard, you know, less than 50% against the target is likely for this year. And regardless of the high number, the higher number target, an increase of around 17% over the 2020 target, there will be factors beyond the control of the government to meet those targets. So what does that mean for our funding as a sector? Beginning in 2022, when again, the current settlement allocation model, or SAM, is used to invest national settlement resources across the country in different regions, and at the same time as an accelerated levels of immigration grow. You've also heard again from my colleagues on this panel, you know, the higher percentage of PR landings who were former temporary residents and the inability of our sector to support that growing need. You know, temporary residents need a national pan-Canadian safety net. They need the ability to access some of the basic settlement supports that we are providing across the country to permanent residents. And this is especially important now in light of the growing percentage of temporary residents who are transitioning to permanent residence. The whole future of the sector is based on hybrid service delivery approach. How many agencies have started deliberating, you know, on how much office space they may need in the future as leases expire because of the necessity of on the future of a hybrid service approach. Next. So 6 recommendations I'd like to quickly share and then wrap up. The Government of Canada. We need to push for universal basic income pilots in Canada. We've had one in Manitoba. We had started some in Ontario before they were terminated. We need to understand the impact of what universal basic income would mean to newcomers. Again, as reflected by this massive confusion of agencies trying to support newcomers through the myriad of supports, both federally and provincially, to non-English, low digital literacy clients. We know from research that's increasingly surfacing around the world that basic income improves health outcomes, provides greater happiness, reduces child poverty, and increases trust in social institutions. For IRCC, the growing digital divide must be addressed through a multi-pronged approach. This is one of our collective greatest challenges in Canadian society that does not solely impact newcomers, but Canadians, seniors, the inability to be able to access internet equally in different parts of the country. The sector, you know, has advocated for years for a Treasury Board cabinet submission that would allow temporary residents to access some IRCC National Settlement Funded Program offerings. This is now more important than ever. This is a political decision. Our IRCC civil servant colleagues, they cannot implement this. This means that the sector has to engage at the political level in pushing this recommendation. Next, please. We need to build upon the fact that immigrants and refugees post-IRPA-GARS continue to be selected based on special needs criteria. Mental health issues, don't tend to surface necessarily within the first year when they can access some support through IFH coverage. We need now a national settlement trauma-informed mental health program. We need to build upon and expand greater flexibility, working with our IRCC colleagues to really refocus our attention on immigrant outcomes. And again, I and others across the country have been advocating, for example, the ability to carry over slippage from one fiscal year to another. The ability to move forward now on the decoupling of program delivery from administrative fees. We've seen flexibility growing through this collaborative relationship. We need to continue to move and explore other opportunities. We need a national settlement sector capacity building approach for training and tools for staff to be able to appropriately support newcomers experiencing racism, family, and domestic violence. And we need a national technology capital replacement budget. This is really important for us. Next. So as we've said at the beginning, the full report and recommendations will be available to you early in the new year. And back to you, Natalia.
Okay, I'd like to thank all our presenters. Naomi, Margaret, Leah, Chris, that was awesome. I also like to echo your sentiments earlier that, it has been a pleasure being a part of and contributing to this working group. So, looking to getting that final report out there. So we have time for some questions. And the first question is for Naomi. Was race-based data used to determine which racial populations were most impacted? And there's a second part. Does it align with current data on the impact of COVID-19 on Black communities?
Thanks for the question. All the references that I made to data refer to StatsCan data. And Statistics Canada has done, I think, quite a remarkable job in pulling together and analyzing all the sources of data that they have and to do a kind of integrated analysis going forward. And that includes race-based data wherever StatsCan has it. They have been able to identify, involvement of particular racialized groups in particular sectors. They have been able to identify some of the employment impacts. So where StatsCan collects the data, has the data, and is able to put together a kind of integrated approach to their analysis, they have done that.
Okay, thanks. I think the next question is for, I think this is Leah. It's a question on the public survey on Canadians' acceptance towards immigrants. Who are considered Canadians in this survey?
Yeah, great question. Thanks for asking it. I did review the results from multiple public attitude surveys, so I cannot speak for all of those because every survey uses slightly different methodology, but often they will include questions asking respondents whether they were born in Canada and whether they are Canadian citizens. So typically, with the results that I showed you, they would not include recent newcomers and refugees who are not yet Canadian citizens. And for certain surveys, they might only include individuals who were born in Canada. So those demographic questions that they ask are really important. And then they essentially, or they may just survey from individuals who they know meet certain criteria to begin with. I hope that answers your question. But yes, every survey does it slightly differently.
Thanks. The next question, I'm not sure, it's about the local health and economic impacts of COVID-19. They're asking, are there health data on local health and economic impacts of COVID-19 on newcomers and refugees? So I don't know if Naomi, if you want to take this one on, or Margaret.
Okay.
I can certainly reference the report by Gutman and colleagues, which was focused on Ontario. That report did look at health, looking at health consequences for newcomers. I think the combination of health and economic is coming from various sources. And so certainly the Stats Canada surveys that have been coming out during the pandemic have been really interesting. I mean, if anything, it represents how Stats Canada themselves have pivoted in response to this pandemic, because they started sort of crowdsourcing the collection of data, bypassing normal sort of sampling protocols that they have. And so some of that data that's come out of Stats Canada is very interesting, because they have been able to identify kind of immigrant populations in terms of looking at what the economic consequences have been. So there is some data out there. I think it's a matter of seeking it out and waiting for some synthesis reports to bring a lot of it together. I don't know if Naomi has some thoughts on where that might have been happening.
No, I just agree with what Margaret has said. StatsCan, in fact, has a whole section on COVID, and you can look at many of their studies that they have done. And a shout out to Feng Hu from StatsCan, who has been the lead researcher on many of these studies, and they're really worth reading. I think in terms of health data, it's more mixed across the country. I think there are some local public health units that are doing a better job than others of being able to disaggregate who has been infected by the virus than others. In some areas, there still is a real concern still about collecting race-based data. Other municipalities have gone in the direction of collecting race-based data. So that has been, it's not even by any stretch across the country.
Okay, thank you. Okay, so this question I think is for Chris, and this question's received a lot of votes. Are there new settlement services that are needed at this time, and what would they be?
Yes, I think the obvious area that we collectively, are struggling with, that needs our collective focus, is on digital literacy. How do we develop digital literacy curriculum, program, workshops that help those with low digital literacy be able to access a hybrid delivery program system? That I see is the greatest need, because those at greatest risk, those that are most marginalized, those that are being impacted the greatest, are the ones that aren't necessarily able to access in-person services in certain regions of the country. So that's where I think we have to come together collectively and figure out, how do we lift those with low digital literacy, with inability to access technology? How do we ensure that they're not left behind?
All right, thanks, Chris. The next question is also for you. It asks, what's the next step for the sector in advocating for expanding IRCC settlement service eligibility to include temporary visa holders?
So I would start by saying, we've started this process. CISA ACSE and OCASI met with the minister virtually this past spring. We raised the necessity of this. We've raised it at senior levels in the department. There is currently a FPT deputy minister working group looking at this. I think it's apparent to all of us, either as individual agencies or through our respective provincial and regional umbrella associations, to reach out to our local members of parliament so they understand the importance of this. So I think personally we have a window of opportunity here, given the highlights, given the Auditor General's report that is looking at temporary foreign workers and the vulnerabilities. This is our chance and we need to run with it.
Okay, thanks, Chris. We have a couple more questions. I think this one can either be answered by Margaret or Naomi. Is there any flexibility being given to international students whose work permits may soon expire? If not, are there any groups advocating for this? Are you aware of any groups advocating for this?
So I would say IRCC is very well is aware of the difficulties that are being faced by international students in a host of areas, and there are groups advocating for more effective responsiveness and greater flexibility and policy reform. And certainly one of the groups that I'm aware of is the Migrant Workers Alliance for Change. They have been very active, focused on international students. And again, IRCC is aware of the advocacy that's going on and has been informed of the multiple challenges that are being faced by international students. And I would say, I think they have been receptive. They've tried to be flexible, and it's been an enormous challenge for them because especially, internally they have the issues of having more kind of bureaucratic flexibility in permit renewals. And then they've also got to face the issue of border closures. They're working with public health. They're working with Canadian border security when it comes to other international students who have the ability to have their permits in place. And so it's so many moving parts. It's been so challenging, but there are advocacy groups and they have been making very strong arguments for reform and for greater flexibility. So I would certainly, if people want to see what those groups are, Migrant Workers Alliance for Change is one of them.
Okay. All right. Thanks, Margaret. Naomi, do you have anything you want to add to that?
I think Margaret's covered it.
Okay. Excellent. Leah, the next question is for you. On the point regarding virtual connection between newcomers and host community members, are you aware of any standout projects in this field?
Yeah, great question. I'm currently not aware of any standout projects in this field. I will say, though, that many agencies that run mentorship programs have pivoted those programs into the virtual space, and those have been quite effective. However, most of those mentorship programs are focused mostly on employment, though not exclusively on employment. I think the Community Connections program, which happened face-to-face, was excellent. I'm not aware of whether agencies have pivoted to a virtual platform, but I wonder if Chris might be able to jump in here.
Absolutely. I mean, I think this has been part of the resilience and the, the pivoting to online services that we have been able, after a period of time of suspending because of our inability to access criminal record checks, we're back in business and supporting across the country, both where possible, in-person settlement mentoring activities, as well as online and virtual. So this is becoming even more important now as we build the capacity, of both the host community and newcomers to settle successfully in this country. And the engagement of volunteers is critically important, and offset by the rise of these racist incidences that have been occurring in different parts of the country.
Right. Thank you. Thank you both for that. I think there's I guess, a related question that both Leah and Chris can speak to as well. What can we do as individuals and organizations to support positive attitudes towards immigrants, including those who are racial minorities? So I don't know who wants to go first. Chris, since you spoke last.
Sure. I think we have to understand, I think part of this starts by looking inward, reflective. We have to understand what our policies are, what are our approaches within our organization. We have to have courageous discussions to highlight perhaps situations within our own organizations that may be inadvertently contributing towards anti-racist incidences. I think that's a starting point. And then looking abroad, outside, again, this is where we need to join together. There is a lot of programming through the local immigration partnership tables and RIFs. Even the National Settlement and Integration Council in early December is having our first ever pan-Canadian focus roundtable on racism to begin creating this national journey around what we within the sector can be doing to contribute towards and building greater resilience and anti-racism in this country.
Okay, thanks, Chris. Naomi, go ahead, please.
I just want to remind people that tomorrow, P2P, the whole day is basically looking at issues of racism and discrimination with plenary sessions and workshops on this theme. So there will be lots of opportunity to talk about strategies and what has worked effectively, what may be considered going forward. So I would commend tomorrow's sessions to everybody.
Okay, all right, thank you. Thanks for that, Naomi. I think we have time for one more question. I don't know who would want to jump in, but ethnocultural community organizations stepped up significantly to ensure first language supports for immigrants and refugees. Is one of our recommendations more resources to them? So these are for ethnocultural community organizations. So
this is an area that we're looking at as part of this. We were not able to provide all the recommendations that this working group has been providing. Mm-hmm. That is an area that we are also have and are considering an inclusion of our recommendations.
Okay, all right. All right, thank you. All right, so I want to thank Margaret, Naomi, Leah, Chris. Thank you so much for your presentations and for answering the questions. I'd like to thank the audience for sending those really good questions and helped us to really have a good discussion following the presentation. So I would like to thank you all for joining us, and I hope you enjoy the rest of the conference.